In this video, we are going to do just a quick overview of all of the parts of Impromed to kind of headline all of the module breakdowns that we'll be doing in following videos. So to start off with, to get into Impromed, you're going to be looking for this eye icon. So it's got that teal with the white eye. It is on every desktop in the clinic, and also it is in some of the toolbars on the bottom, but not all of them. So if you're ever not in it and you need to find it, just look on your desktop. The next thing is going to be our server selection. They should all be pawcore/Impromed. Don't mess with that. That's just basically the routing to get into the server, so that stays the same all the time. And then the next is going to be our Impromed login screen. So we have our operator name, which is you. You're going to type in your password, and then we also have a database selection. The default here is going to be Impromed. That is our live database. However, if you're training, we do have a training database as well. That is just an old backup, so you can try stuff out in there. You can click around and do all sorts of things just to kind of work your click paths in, but that is something that does not impact our live system at all. The last thing that you'll see on the login screen is going to be the desktop type. Now, this is typically going to be associated with your role. So if you're MSS or CVT, it should say technician. If you work CSS, it'll say reception, and then the doctors have their own as well. So once we get logged into Impromed, we're going to focus our attention up into the top left, which is our Impromed icon. And this is basically our start menu for the program. Really, you want to focus your attention primarily to the modules option, because what you will see when we get out of that menu is we do have our tabs, which is medical records, patient processing, reports. Those are all modules, which we'll get into in here in just a second. If a module is not open, this is where you're going to go to find that option. There are a lot more things that we can do in Impromed, but just for a tier 1 perspective, all you really need to know about your Impromed icon here is that when a module is closed, this is where you go to find it. The next area of focus will be kind of our top toolbar, so where we have home and client, invoicing, all of these things. Again, not really an area that we utilize all that often. What you'll find in Impromed is that there are a lot of different ways to do the same task, and this is one of those areas where all of the functions that we would use this toolbar for, we do in other areas, so don't really feel like you have to focus on that area all that much. Moving one layer down, you'll find a lot more functions. So going from left to right, we've got our little patient icon here. We have some patient information here, including our Impromed account number, our Impromed account number patient ID. So this is patient 0A, our caregiver name, as well as our patient's name. Then we have our find function where we search for accounts for clients, but also for patients. Then we have our maps function, which does hyperlink to your Internet Explorer to bring up the caregiver's address that you are currently in their profile, actually in Google Maps. Next to maps, we have our database selection tool here. So if we click the green and yellow bins, that would open up the database module, but also next to that icon, we do have the drop down where we have create and edit client and patient options, and we'll get more into those in later videos. Next to that, we have our quick search options. So if we just want to quickly look up somebody, not having to use the find function or bringing up that full window, we can do that here. It's a little less intuitive than the find window, but an option if you have a really specific name of a client or of a patient. Below that, you'll see a red X and a phrase that says not ready to conclude, and this is just a invoice status icon. So if an invoice is ready to conclude, it'll have a green check mark next to it, as well as ready to conclude as the phrase. So just a quick access point for one of the most frequently discussed items that we have here in our clinic. Next to that is going to be our client and our patient pop-ups. This is where we're going to have basically unique instructions for the client or the patient. So let's say the client is a 501c3 account and they get invoiced after services or something like that. You would see an account come up for that. But also for patients, if we have patients that maybe chew leashes or are potentially aggressive, we're going to have those in here as well. Definitely always read your pop-ups when they appear when you open up accounts for clients and for patients. Next to our pop-ups is going to be our operator and provider drop-downs. Really not fields that you would have to modify really at all. But above that, you'll see the lock operator option, and that brings up the login screen that's within Impromed. So you can select your drop-down for your operator ID and then enter in your passcode there. And then the last item to the right is going to be our desktop selection. This is going to be something that very few of us are going to have multiple options here, but below that you'll see the lock with the actual terminal ID number. This will lock the entire computer and bring us back to that kind of lock screen. So if you're ever in a room utilizing a terminal, be sure to select this button prior to exiting to make sure that caregivers aren't able to access the computer. And then if you're ever unsure of if we have the most current information for either easy time or medical records or patient processing, there is the refresh function here, which does reread the server to make sure that the information that is populated is most current. Then we move over to the left side of our screen where we have our recent clients, our recent patients, and current invoices options. Now these are blurred out for the sake of privacy. However, most of the time, all of the terminals across the clinic are going to be on recent patients. And the way that this function works is every time that any terminal brings up a patient account, it is going to go to the top of the list of recent patients. That functionality works the same for clients. So if we click on recent clients, you'll see the same type of list, but it will be in client access order, not in patient access order. And then the last item that is on this sidebar is going to be current invoices. Really not something that we use in the patient care process. This is more used kind of on the back end within financial management and all that sort of stuff. But if you ever do need to see all of the open invoices, that is where you would do that. Then in the center of the screen, you will see the client or patient dashboard. And depending on what you have selected in your drop down here, you will be able to see basically the database entries for the client or the patient, depending on what's selected. If you do need to, you can double click into any of these fields to edit them. However, we'll go through what each one of those fields means and what they are supposed to say, kind of how they're supposed to be accurately formatted in our database module video. But in our dropdown, you're going to see patient not selected, which is going to be our client access. And then you're going to have a full list of every patient that is included within that caregiver account. Next to that, our primary window is going to be our patient wait history. So every time that a patient visits Paw Health, they do have a wait recorded and then entered into this area. So you'll just see a full summary of basically every visit and what the patient weighed. But also above this, you'll see those 5 options, that one that looks like a time clock, the one that kind of looks like an invoice, so on and so forth. So moving left to right, the icon that looks like a clock is actually going to show us all of our scheduled appointments. If we ever do need to review when a patient did have an appointment either in the past or in the future, this is where we could do that. Next to that is going to be a button that is actually a way to access our invoices area that is within patient processing. It actually brings up another pop-up window. I really don't recommend you use this one. It's a lot easier to just jump into your patient processing module a little bit down below. Next to that is recheck. So if we have a patient that does require kind of a recurrent visit and it is entered into Impromed here, this would be where we could see what those are. The next is going to be our reminder report. So this is going to be if we have vaccinated a patient, we do enter in all of the due dates as well as the perform dates of each of those. So this just brings up a summary of all of those vaccinations that have been completed, as well as heartworm tests and Giardia tests and fecal evaluations. Next is going to be our weight history report. So everything that we're seeing in our weight history, we are able to get into kind of a nice printable form, and we can access that here. And the pencil icon next to that would be to edit the dashboard as a whole. No need to worry about that. On the lower side of this area, you'll see reminders, weight history, diagnosis, and RX. So reminders is going to be our vaccination as well as our preventative diagnostics. So fecals, Giardias, and heartworm tests, we're going to have reminders available in there. Next is our weight history. We kind of already went over that already. Diagnosis is not a tab that we use here at Paw Health, so no need to worry about that. And then RX is going to be a list of every prescription that has been prescribed out to the patient that is selected. This is really something that is utilized by medical staff and we'll get into in later videos. Within weight history, we do have the options to add and modify entries. When we add entries, we actually do that through our estimates process, which we'll get through in later videos. But if we do accidentally mistype an entry, we can modify it as well. The next item to focus on is going to be our modules tabs. Each one of the desktop types, whether it's reception or it's going to be our technician or doctor, is going to have different tabs that are automatically opened when you log in. But generally speaking, almost all of them are going to have medical records, patient processing, and easy time. Those are kind of our big three. And we do have individual videos breaking down each of those modules. However, if you are not able to find the module that you're looking for, again, go up to your Impromed icon in the modules drop down to access that item, and it will populate itself onto this tabs bar here. Again, there's a lot of different modules, and each one of them is going to have their own breakdown, but to access the modules, you're going to do that on the tabs options here. So that's a really quick rundown of kind of what you're looking at within Impromed. We're going to have more in-depth breakdowns of the modules and kind of how they work, and even sub-breakdowns, because the modules are pretty much where everything happens. But as you work with your SRMs, you'll really start to develop click paths and kind of where you're most comfortable performing the tasks that are necessary. One thing that you will find with Impromed is that there are a lot of ways to kind of perform the same task. Like we kind of covered earlier with the find function, but also we have our quick search option. There's a lot of different things that are kind of duplicate options here within Impromed, but you'll find the ways that are most comfortable for you to perform the tasks that you have to in your job here at PAW.